Hello everybody, Dr. Carlo Oyer, board certified emergency physician with DrER.tv, but you're watching ED Exit Video Pro. This is a channel directed at healthcare workers, pre-healthcare workers, medical student nurses, anybody who wants to learn about medicine. And we have a cool one for you today. A 58-year-old man presented to the emergency department complaining of urinary difficulty and back pain. Well, that could be a urinary tract infection, kidney stone. Examination revealed a rash on his left flank. Now, that's unusual. We don't usually see that. And laboratory evaluation revealed a UTI. So definitely the signs of a UTI. That means leukocyte esterase was positive, maybe the nitrates, the amounts of white cells of leukosuria was high. An increased creatinine level. Normal, it should be about 1.1, 1.0. So that's elevated, and we perform a CT scan because the CT scan will look at the kidneys. Is there a kidney stone? Is there signs and symptoms of hydronephrosis or swollen kidneys, and so on. This is a closer look at the rash that we were talking about. You can see that redness. I mean, that looks like cellulitis, some kind of infection on the soft tissue, right? This is the CT scan of that patient, and what are we looking at here? Let's go through the structures. You got the kidney, right kidney, left kidney, spleen, you got liver and gallbladder here. Of course, the spine with the ribs here. And the major abnormality we're seeing here, and whenever you're in doubt, you just divide it up in halves and compare halves. So compare right to left. Obviously, there's some organs that are not on the right or the left, like this is missing here and so on. But it's here. Look at his back, and remember, he has a rash, a discoloration of this area right here. So notice all of this. There's some kind of inflammation, swelling, and look at the inflammation. It's kind of coming from the outside of the kidney and then going into this here, all right? This is another picture, a different level, and there you can see clearly. Look at his chest wall and flank. It's all like swollen, and it's got all this air like that and all this inflammation here. So that's what you're looking at on that initial picture. That there is this here. So that means there's some kind of infection that starts in the abdomen, is tracking into his torso. So this patient has a perinephric, that means next to the kidney, abscess presenting as a rash. This perinephric abscess extended beyond the perinephric region into the psoas muscle and subcutaneous tissue. The abscess required surgical drainage and 2 weeks of intravenous antibiotics. E. coli, Escherichia coli, grew from the urine and wound culture. So it definitely started as a UTI, as a urinary tract infection, progressing to an abscess in the kidney, and that into a perinephric abscess into these soft tissues. The patient did improve without permanent sequelae, and the infection was attributed to a neurogenic bladder dysfunction. The patient wasn't peeing adequately, so he retained a UTI, and that causes that. A perinephric abscess is a localized collection of pus, purulent material, between the kidney capsule and the Gerota fascia. It's often the result of untreated UTI. Intranephric renal abscess, recurrent pyelonephritis, obstruction, or hematogenous spread. Common etiologies are E. coli, like this patient, but also Proteus and Staph aureus. Onset of symptoms is insidious, I mean it's slow and gradual, and the majority of patients report pain more than 14 days. Symptoms are usually suggestive of pyelonephritis, including fever, dysuria, and flank pain. So in the initial presentation, it all sounded like a UTI, maybe a pyelonephritis, which is an upper tract urinary tract infection. Physical findings included costovertebral angle tenderness, or CVA tenderness. Rarely, this is why this is such a cool case, because that's rare. A palpable flank mass or rash is present, indicating the invasion of that infection into the subcutaneous tissue. The mainstay of treatment is percutaneous drainage, means surgery, and intravenous antibiotics. So the important thing here is that Not all UTIs are created equal. Some will progress into the outside of the kidney and extend into the soft tissues and into the flank, and sometimes even you'll be able to see the infection on the examination of the patient. So, hope you like this case. Hope you learned something about UTIs, perinephric abscess and infections, Gerota's fascia as it invades through, and then the different organisms that can cause this kind of infection. We talked about E. coli, Proteus, and Staph aureus. And this is indeed a medical emergency that requires admission and aggressive IV antibiotic fluids and all those good things. Again, I hope you're liking this kind of videos, that you're learning plenty. Please go back and look at the list of videos and enjoy them as I post them daily. Take care, guys. Bye-bye.